Welcome back. This Marego TV time for main discussion today is on health. Hypertension or high blood pressure is a condition where the force of blood against artery walls is consistently too high, typically 140/90 or higher. It's a major risk factor for heart disease, stroke, and kidney disease, affecting approximately 1.4 billion adults worldwide. Do you know this? I am Nana Suya. This morning I have Dr. Osman Alidu from the St. Martin de Porres Hospital in Agomenya to have a discussion on hypertension. Umoja monsono eti saying, "Woni baby eda, ya kase BP a, e kodru say na da na BP. We are sure so BP, low BP, high BP, newe he na yehu. Kajibe ne omwo sida na ngeke, inga hiyo lo nga suba, omwo ebenolo, oya hye nga hiyo chame helo, alo monicha no ahyo chopako ne onu." In view of this, sit back and enjoy the show as we discuss hypertension this morning on Marego TV. You can equally join us on all social media handles at Marego TV, Facebook, Marego TV on Instagram, Marego TV on TikTok, and the other social media handles. Doc, you're welcome.
Thank you.
How have you been?
Oh, fine. We are doing well.
First time Marego TV.
Yeah, this is my first
This
time
is
here.
Marego TV.
Oh, thank you. Thank you for giving me this opportunity to be here and to talk about hypertension and to enlighten the people, teach the people the things they need and what they are supposed to do, what they are not supposed to do, so that all this, how should I say it, all these side effects or anything that will happen due to this disease will be catered for.
I gave a little intro, but let me come to you as the medical officer. When we talk of hypertension, what exactly is hypertension?
Oh, hypertension.
And who is hypertensive?
Yeah, so hypertension is actually a chronic disease which is characterized by persistently high blood pressure, which include both the systole and the diastole.
Please speak a bit louder.
Hypertension is a heart disease, chronic heart disease, which is characterized by a persistently elevated blood pressure. When your blood pressure is persistently elevated, sometimes somebody can go to the hospital at the first time, BPs are being checked and the BPs are high, they say you are hypertensive. No, we need persistently high blood pressure. Sometimes we even go ambulatory blood pressure. We monitor our blood pressure for some time before you can say you are hot, hypertension, because you have a lot of factors that can affect your BPs. Yeah. So
at what range would you say this patient is hypertensive?
Oh, we have a systolic blood pressure more than 140 and a diastolic more than 90. You can see this person is what? Hypertensive. So
you saying systolic and then diastolic. I might understand what you mean. Can you please explain a bit better to my viewers?
When they check your blood pressure, there is a top one.
Okay, so the one at the top. The one something.
Yes, that's the systole. The one at the down is called the diastole.
On a normal human being.
Yes.
The one something should be at what range? The one at the top and the one at the down should be at what range?
So in a normal person, we need a systole of 120.
120.
And the diastole of what? 80. That's in a normal person. Anything above that is elevated. But before we say you are hypertensive, we need to record anything above 140, 90.
149. That is when you'll be given a chart.
Yes.
You have to follow a chart to take in your blood pressure for a while before you give no medication.
Yeah. Sometimes when we are suspecting something of that sort, we give you a chart home. So you will be checking your BP maybe every morning or morning and evening, and you bring it and we strike the average and we see whether you are hypertensive, or maybe there's some factors that is contributing to what these elevated BPs.
No, wait, that's my head. You
have most of the things on.
Talking about the factors, what are the factors that bring this hypertension?
Yeah. Currently in the modern world we live in, majority of the things we do are increasing our risks.
Talking about our lifestyle.
Our lifestyle, sedentary lifestyle. We sit the whole day. We want to go out. We enter into our car, we get home elevators. We actually don't do nothing. You see, and something like food. Yeah, the food we eat. Yes. High fatty foods. And now I don't think we even go by the regimen of eating. Somebody can just get up, eat indomie and egg at night, probably 10. You understand? Alcoholism, drinking. Yes, drinking alcohol also increase our what? Risk. Smoking. You know, majority of the youth are into alcoholism and what? Smoking. Obesity. Chronic stress. Now we are all stressed. As I'm sitting here, I'm stressed. You're also stressed.
I am stressed.
Yes. So it's another big issue for us. We are all stressed. So these are some of the, let me say, environmental factors that I think in Ghana right now is really hurting us.
You know, yesterday the president was like, non-communicable diseases are on the rise. And so we ought to eat earlier and not eating late. And somebody's were like, a president said, it's not that what point Juma you are not come to take banku and other thing. You need to take something light. Yes. And then somebody was like, what are you want to watch more? I've been here on my day or my tea no
Yes.
All of that.
Because if you follow the correct diet regimen, from 7 p.m. going, you are not supposed to take in anything.
And the person was saying, what are you I've been here on my tea
It all comes to our indisciplined nature of the way we take things as Africans or as black people or as Kubus in this enclave. You see, you have to eat breakfast, eat lunch, and probably supper. Somebody will not eat since morning. Imagine the market woman don't know it's up to the time they get home. So after 7, that the president was mentioned, not for somebody has prepared his fufu or banku or something, and that's what is going to happen for the night. So they'll make sure they finish their heavy diet before
they sleep.
So probably that's the only food that
they have
for the whole day. Though they'll be taking some snacks along the day, but that'll be their major food for the day. So it's about time we discipline ourselves and we take some of the instructions very judiciously and all that. Yes.
Okay. And even after eating at night, we don't also exercise. Does exercise also come into this?
Yes. You see, right now you place a petrol in a car.
Okay.
You fuel the car is still at where it is. Though you may need energy for any cellular or this thing, but that one is not much of the energy you need for the day. So at least that means advised that after eating, just be active for at least 3 hours before what? You sleep. At least 3 hours. At least before
3 hours before you
sleep. So imagine you eat at 7, maybe after 7 you see when you have a heavy diet, the probability of you sleeping is what? High. So imagine you've eaten this banku that you are saying, fufu, you go into the bathroom, you wash down, and that's it. I don't think you can be active, yes, for the night.
And doctor, to continue with, do we have a particular age that one must be hypertensive?
We have the hypertension. We have 2 types. We have 2 main divisions. We have the essential ones, which is that one is age related.
Okay.
Maybe from right now, we even have people from 25 going developing essential hypertension. Before we have the secondary one, which is due to some diseases, something that you have that is predisposing you to what? Be a hypertensive. So the essential ones is due to, we have something called atherosclerosis. Your vessels, they become sclerosed, thickened. So when they become thickened, it means, you see, it's like the heart is trying to pump against what? A thickened vessel. So it's going to what? Increase what? Your blood pressure. It's like we have a choke gutter. They are trying to push water through. It's going to, you need more force to push that water through what? That valve. So that's how it is. And the secondary one, after that one, you can get it at any age. Even children can have it. Babies can have it when you have some condition that predispose you to that. But the major one right now is what? The essential one, which is the primary one. That's what people are really getting. It's multifactorial. This smoking that I've said, all this sedentary lifestyle, you eat a lot of fatty food, no exercise, chronic stress. it's a constellation. So all these things comes together to what hurts you.
Doc, you know we have some diseases that have symptoms.
Yes.
Hypertension. Does it have symptoms?
No. Actually, I would say no. Because that's why they call it the silent killer.
That's the other name for hypertension.
Yes. Is there the day he strike, if you don't take care, he will make you cross over. That's how hypertension is. Though some people will be coming with persistent headaches, early morning headaches. They'll be coming headaches. And others will be having some form of dizziness. Some people will say they have a lot of palpitation, which means your heart is beating really fast. You are feeling your heartbeat. So that's palpitation. But majority of the people don't come with anything. You may not feel anything. And you see, our assessing, when somebody have headache, what does they do? They take water and they take paracetamol. So you are maxing the symptoms. That's what we do. We max the symptoms that are supposed to be what? Followed up. In the morning, start feeling headache. Oh, maybe yes, I no sleep, or it gets on ibuprofen. You know you can get this over-the-counter medications. You take them, you drink some water, you'll be fine. But the disease itself is there.
It's all there.
It's there. So you don't get any symptom, like a peculiar symptom that somebody is coming with. Malaria, that they have a symptom that they come with. Hypertension doesn't have anything of that sort. If they strike one day, that's why we want screening. We check your BPs. Then we tell you what is actually wrong with you.
Look, my research, or sometimes I hear people say, asimesi radio or low blood pressure. Maybe so you say high blood pressure. And chichemono, what is the difference between those two? And which one is very risky?
All of them are risky. If I'll take the risk aspect, all of them are risky. When your BPs are becoming low, persistently low, you are dying.
Wow.
Yes, you are dying. Persistently low, you are dying. And when it's becoming persistently high too, you are dying. So we want to maintain the BP in a particular range. So it's a range that we need to maintain your BPs. Anything 120 to what? 139, 89. I think we are okay. When you are recording BP 100, 80, or maybe 90, 50, it means there is also what?
A problem.
A problem. But sometimes it depends on what the cuff we use. Fortunately, I wasn't able to, as you said,
I told you.
I was able to bring the
to that, yes.
cuff. But we have appropriate cuff for each and every one. You understand? But it's in our setting, we use the same cuff for what? Everybody. Somebody may have a big biceps and triceps. You see the forearm is very big. So when you use the medium cuff for that person, maybe that person is going to record what? A higher BP than somebody like me. So that's also what plays a role. That's why sometimes when we see some things like this, we see as a special patient, we can give you the chart for you to go home, check at different places, or we can check the car for you in the hospital, and we'll try to what? Check and correct the blood pressures.
Okay.
But either of them, high or low, is not good. Anything below, I think 180 is not good. Anything above 140, 90 is also bad.
If you just join us on Marego TV, we discuss on hypertension, and I have Dr. Osman Alidu of the St. Martin de Porres Hospital in Nagomenya, Luamanya, here with me this morning. If you're leaving home, don't worry, you can still join us on all our social media handles. That's at Marego TV at Facebook, Marego TV Instagram, and Marego TV on TikTok and X. Doc,
yes.
Talking about the calf, right? Yes, I have a friend who was sick and said she wanted to visit the pharmacist. We went there after the BP check. The pharmacist was like, "Hey, BP was through go hospital. Meet me, ma, it's all hospital." And it was around 160 something over 118 or so, very high. They meet me check. I said, Then the person looked at me and said, "Charlie, they think the man they talk. You sure? How they feel anything? Say my heart they beat that kind of thing, though." I said, "Okay, then why don't we go to the nearby clinic rather?" So we drove to the nearby clinic, and then when you go there, definitely they will check. Once the clinic, they will check your vitals. Yes. So after taking the temperature and the BP, it was 138 over something. Then I quickly asked, Patron and the BP to say, I said, oh, okay, you're not. I said, we are sure. I said, so BP in Tina Yaba how? I said, BP, I said, you got paid rat or something, you could do, you know. Pharmacist, they check, 160 something, or CM hospital to me. Then I quickly saw she looked at the other nurses face, so they're trained, Dr. Ba, or beside Ashel. So we sat for about 5 to 10 minutes waiting for the doctor to come. When we went to the consulting room, I followed up. The doctor have to check it again. And then when they checked, it was now 136 over 90 something. Not just say, it was still within the range. Don't you think, say, those pharmacists or cancer are trying a DHR? Yes. And you have wrong information. And no, son, what will you do about it?
It has been happening.
Okay.
Sometimes we be at the hospital and we bring start BPs. You see, immediately, anyone, as Ghanaians as a whole, we enter into a hospital facility, a pharmacy or something, the anxiety is what? High. You see, so in normal circumstances, let me say this, you have to be trained to check blood pressure. I don't think pharmacists have been trained to do that. I don't know of that, but I don't think pharmacists have been trained to check blood pressures. Yes, I don't think so. When someone comes and you are about to check the person's blood pressure, you have to alleviate any form of anxiety. Oh, please have a seat. I'm coming to check your blood pressure. You have to wait at least 5 to 15 minutes. The person sitting down, so the person calm him or herself, calm down before you can check the BP. Even at some instances, you have to even introduce the patient to the cuff you are using. Some of them, when they immediately see the cuff, their hearts start beating. So that we call it white coat hypertension. Immediately they see you as a doctor or as a nurse, their hearts start beating, anxiety high. When you check the BP, you are going to get skyrocketing BP, which is not really giving you the picture in hand. So you have to let the person sit down at least 5 to 15 minutes. You talk to the person. This is what I'm coming to do to you. This is the cuff. I'll put it here. You explain everything for the person. After that, you let the person sit down. You see, you don't check BP in any position at all. No. You have to let the person sit down upright, back supported. You understand? The arms have to be free. Any tightened clothes need to be loosed up. So when you have this condition, everything at place, and you check the BP, and it's still high, then it means the person is hypertensive. And you can't even check the BP once and say the person is
hypertensive.
No. Actually, we check it for 3 times. First, second, and third. Either you take the last one, or you strike the average of the last 2. That's how we check the BP and say, oh, this patient Even with that, if we are not really sure, we give the one that you take home and you bring it back.
The chart.
Yes, please. So I don't think people are doing that. You can be seated right now. Oh, come and check my BP. The person just can put the cuff over there, check your BP. Oh, your BP is 190, 120. You are hypertensive. You have to go for medication. Very, very wrong. But it's happening in our setting. So we are trying to educate people how things need to be done at the right place and the right time.
Doc, is BP curable?
No. When you talk about the BP being curable, then you are talking about the secondary ones. The secondary ones, when you are able to treat the underlying cause, your BP will go away. But the essential one, which is the primary one, is not curable. It's manageable. We will make sure we keep you for the lifespan you are supposed to live on earth.
Doc, can I do a self-medication? I went to a pharmacist. My husband sent me BP na kosro. Can I say, "Pacha, no BP, mami adrenaline"?
No.
What do I do? Is it preventable?
You have to come to the hospital. You see, the BP, you see the diastole, you see the systole. This one have to be high, this one have to be high. But we have some stratification you need to do before you put the patient
on medication.
Yes. We have others, their BP is very, very high. The systole is very, very, very high. We have some, the BP, the diastole is also very, very high. So when you know, as a doctor, when you see these things, you know the kind of medication to give. So you can't go to the pharmacy and say, I have BP, give me medication. No, it's wrong, totally wrong. We have to see the BP. Which one is actually causing the problem? Is it the systole or is it the diastole? When the diastole, we have the type of medication we give. When the systole, we have the type of medication we give. And sometimes we even give combinations, up to 3 combinations of BP medications. So going to the pharmacy for BP drug, except if you are being given a prescription by the doctor to go and purchase the particular medication. Apart from that, no, you don't self-medicate when you have.
Is it preventable? If yes, how do we prevent it?
People going to the pharmacy to purchase their own.
No, preventing of BP.
Preventing, yeah, the lifestyle modifications.
Please educate us.
The lifestyle modification, exercise. You see, like I said earlier on, most of us, we don't even walk. Car to elevators, to bed, to chair, to everything. So at least you have to get what? Exercise, what? Stress-free what? Exercise. Most of the, you see, you can see someone walking, like you walk from, let me say, Udumasi Krobo to Agomanya every day. Though the person is exercise, but there's stress associated with what? That exercise.
Oh, okay.
You understand? The intentions of the person what walking. Somebody maybe he doesn't have the money to what take a car. So if that person is trekking, it's under what stress and what frustration. And under this sun, there's also what stress associated with what the walking. You understand? So we need to exercise stress-free, intentionally. Exercise to your limit. You see, we exercise sometimes. They say exercise, and some people will just exercise what above what the human limit, and you develop other what cardiac conditions. And the food, eating, we also have to eat what?
Eat well, healthy foods.
Healthy food, like more fruits and vegetable. Red meat needs to be what? Reduced. I think chicken is better. Fish also have to what? Increase in what? Our diets. Low fat diets. People like cheese. Right now, pizza is something big. It's a big this thing.
Pizza, shawarma.
Yes, it's a big deal now. People tend to.
Is it good for us to be taking it?
Actually, I mean, no, I'll not debunk or I'll not say pizza is not good. Yes, but if you look at yourself, you have to know that
pizza is good for you or not.
Or not. You understand? So when you take pizza, you know there's a lot of cheese in it. Cheese and carbo. All the down of the this thing is carbohydrates, and the top is cheese and other vegetables and stuff. Some people even have meat in it. So I may not say this thing by looking at yourself and your level of. You have to know that this food is good for me or this food is what not good for me. Talking of the weight, we have to check our weight and our height. You see, we have something called BMI. We have something called BMI. We need to check your weight and height and be able to know whether you are overweight, you are obese, because obesity is one of the risk factors. Okay. So stop smoking, no alcohol, reduce stress, sleep at least.
No alcohol, cry.
No alcohol.
Cry.
Yes.
Doc.
If me, I'll advise you.
No alcohol, cry.
If I will advise you, I'll advise you not to take alcohol.
Because
the BP you are talking about, it's not only due to alcohol is going to cause a whole lot of problems more than the BP. It's going to cause a whole lot of problems more than the BP. So if me ask me to ask you not to take alcohol, not to drink alcohol. You see, most of the food we eat contains alcohol in some amount. Kinky, banku and all that. There are some level of alcohol which the body needs alcohol in some way. So I think that one is enough for us to to stay healthy and be alive. Yeah, I think it's okay for us.
Hypertension, being hypertensive, maybe BP. Is it hereditary?
The essential. The first one is hereditary. It's hereditary. So with that one, I may say it's hereditary. The secondary one, there are some of the diseases that will predispose you to hypertension that are also hereditary in a way with some environmental factors and all that. Yes, I would say that.
Thank you very much, Dr. Osman Alidu. Let's switch a bit to our local dialect. Ila malika, hiyo none angedenga epitimi oslomambi keko ine wahi ne wayu wahi kaje ni ne zebene pene hiyo no ekubagba wanya kambe no denga frane mi. Okay, the silent killer. Omana kando ko benga bako opiope ina ne babe.
Good. Mamodi. Yo muchum. Yo, Cloma.
You put on your camera.
This one. Yo, Cloma. Tell me, Dr. Osman. Here, the Marego TV. Ne wange munyu tun about hypertension, neji high blood pressure, neji chihio, ne ngewoni funya bae. Ne funa ngemi yemo na limnge St. Martin's de Porres Hospital. Nye nami da no. Lo mo ne kema guyom no ni maget lo nye ken. Yo na ngede yo papa. Se ni funge ne mama pene ima ba wa chances lo blono tonu wa ke mana jama hiyo. Lo ni wa muni ko mekan wa nye ni yemi exercise kan ma kan hebo kan danumi ke no me ke stress neji hi hawo mi ngeni ko mam like nyagba mi ke ni ke onye no bajama ni o mesion o chances no mana jama hiyo e ma basin ne no e ko unji ke oba hospital na dem ke onge BP o no ji ke o chupantan esa no ba chabe no matis no ma he chupanga he ko no ma de ke o ami chupa ne ya he debi ai ga BP fen ko ke chupa mini pan wa ga BP chupa pan kaka kan 9 ne wa use o hani lo no fen no ke pan lo ma de ken o asima si no nge no nu lo imu ya he no ne manu lo ya ngole hwen no ne mini manu debi ba ne mo chupa ne o BP o edi o ke chupa ne wa hamo no fen no pe nekin BP o abi ma chale kra na ma de ken wa chale neji kra debi se chupa mo balesin ne jehane mo hamu no ba yin je no o ma pepe kas be ni mini o ma gbo ne BP obi mo hawe ye chemele BP or stroke kan ni fun ne wa na nge hospital of St. Martin's our number one cause of mortalities complications from hypertension nge wa St. Martin's hospital of ni ne gbe oni wa lo ni ne hane ni tan ni oni ayiwa ji mi BP ke ni ne ibangesi o mi hane ni na jama nyagba mi o mi ne lo ipa ne pe comme ne on kan oyino ngamo kon titri motuma oyino ngamo kon lo mana kan hem ngamo chichen lo chinga fia bum ne o mana kan mo chongo ti onu kan enga fia ngo o gugwem mana kan no ko bi o ba ne mini wa check o BP amo lo wa St. Martin's ne wa gun wa ba nge Marego TV mo no wa kwa ma tonye ni nge BPI yo nyechun.
Okay, Dr. Mochum, thank you very much. Just mention stroke.
Stroke.
Quickly, no
stroke G.
You can speak English.
Okay. Stroke is one of the complications of hypertension, which is very, very detrimental and high level of mortality and mobility. Is when the blood circulating to your heart has been reduced in any form. We have two types, which is hemorrhagic, which means your BP has been elevated to the extent that the vessels in your brain has burst. And you start bleeding your brain. And the second one is due to atherosclerosis, that the endothelium, like the inner of your vessels, have been damaged and they form a clot in it, and to prevent blood flow into your brain. And you see, the brain always depend on oxygen. Any deprivation of oxygen, you are going to get a brain death. So part of your brain is going to die. So that's what stroke means. Part of your brain responsible for some particular action has been damaged by the low blood supply or lack of blood supply to that part of the brain.
Thank you very much, Doc. Our time is almost up. Kindly give us your parting words as we leave the studios of Marego TV.
Yeah. As we said earlier on, hypertension is the number one cause of morbidity and mortality worldwide now. We also call it the silent killer, because most of the symptoms are being masked and you will not be able to, even though they are not specific. So the only way you can know whether you are hypertensive or not is you come for check up, and we check your BPs and we take it out from there. And please, the self-medication, I have to hinder on it again. It's not really advisable. You have to come to the hospital and we'll diagnose you and we'll give you the appropriate medication that will cater for your BP, not other person's BP. Because every person is different. Every patient is different. Thank you.
Thank you very much, Dr. Osman Alidu, for educating us on hypertension. Our viewers kindly get close to any health facility check your BP. BP checking is free, and
It's free.
BP checking is free. Just walk to any health institution and say you're coming to check your BP. It is free, so you can know your BP level, whether you are supposed to be on medication or not. No soft medication for a BP patient. Once again, let me say a very big thank you, Osman Ali, doctor from the St. Martin de Paris Hospital, for coming all the way this morning. We say we appreciate. Thank you, viewers, for watching us too. Before I